So this is our 15th webinar for the Circle of Cleft Professionals. We're delighted. Long-term, founding fans of the Circle of Cleft Professionals and long-term leaders, Dr. Trina Sweeney and Dr. Debbie are online. We've worked through some of the technical gremlins, and we're glad you're here at 8 a.m. in Toronto, 1 p.m. in UK. And if you did start a little earlier in the waiting room, we apologize. I'm glad you're still here. So we can go to the next slide, Niti.
Yeah.
So I'll invite you to walk us through, Niti, where we're going and what's happening today.
So, just for those who are new to Zoom or relatively new to Zoom, please share your first and last name with us so we know who we are interacting with today. If you, there is an option in Zoom to change your name while you're in the meeting. So all you need to do is go to the participant button, and then you have the option of renaming yourself. So we will be muting your microphone while the presentation is on. This is mainly to just reduce the background noise. Please use the chat feature for sending across comments or questions while the presentation is on. Again, for those who are new to Zoom, you have the option of just going into the chat button, and you just click on it and you can begin chatting. And you also have the option of moving around the chat box and placing it wherever you want on the screen so that you can access those comments and questions and not miss out on any conversations. After the presentation, we'll be inviting you to ask questions. You can choose to do this either via chat, or you could also choose to ask the questions yourself by video. If you're choosing to ask a question by video, then please just remember to unmute your microphone when you do that. So that's it from me. Over to you, Hugh.
Sorry, three boxes open at the same time. Thank you, and definitely we're delighted to, if you weren't part of our little chat before we started, do send along your greetings in the chat feature. It's great for everyone to understand where we are and where we're calling from today. Next slide. So, what are the objectives of the Circle of Cleft Professionals? Definitely, we're trying to facilitate this kind of collaboration and networking. You'll see that some of us recognize one another, and there's a lovely connection as we try to encourage one another in comprehensive cleft care. We want to communicate the impact of this learning and give support wherever possible to those teams implementing comprehensive cleft care. So we are almost at 200 members now. 12 specialties, 37 countries, and we have a neat graphic in a second to show you where we are. Many surgeons, lots of speech therapists and orthodontists are the most represented, but you'll see we do have representation from across the specialties associated with comprehensive cleft care who are members. And if you do know someone who should join, please feel free to invite them. We'd love to grow and continue to learn together. You can see a little bit of where some of our hotspots are, not for COVID, thankfully, but for membership in the COCP. There is a nice representation on this call even of people around the world implementing comprehensive cleft care. We do want to thank always our charity supporters, all 10 of us from around the world who are invested really in seeing how we can equip comprehensive cleft care teams in low and middle income countries. And without further ado, we're delighted, as I mentioned, to have Dr. Trina Sweeney and Dr. Debbie, long-term fans and champions of this type of learning, who I know have been diligently working on moving some really innovative research into practicality. So all of us now are thinking through what remote or home-based speech therapy can look like in this COVID era, as we've been talking as a backdrop for everybody's comments today. And the platform they developed is called Speech at Home. And so you can see here, Dr. Trina Sweeney is a cleft specialist speech language therapist who's worked for many years at Dublin Cleft Centre and Dr. Debbie is also a cleft specialist and a senior research fellow in the Centre for Outcomes and Experience Research in Children's Health, Illness and Disability. And again, at Great Ormond Street Hospital, Gosh, in London. So we'll pass it over to Dr. Trina and Dr. Debbie. They're going to leave lots of time also for discussion and for us to think about what their research and what the Speech at Home platform can teach us as we think about implementing speech therapy in remote and home-based settings. Oh, and the transition, the technology worked. It was so smooth, Trina. Well done. Amazing.
You see, practice makes perfect. Good morning, good afternoon, good evening to everyone, no matter where you're from. Thank you so much for joining us, and thank you to the Circle of Cleft Professionals for inviting us to present today. This webinar is on empowering parents of children with cleft palate speech disorders, and it's based on research and development carried out by Dr. Debbie Sell and myself over the last 8 years. First of all, we would just like to acknowledge with our funders for our research and our funders for the implementation of this research. So the background to this research: we know that children with cleft lip and palate have high needs for speech therapy intervention, and that at least 50% of them need speech and language therapy, and some with complex speech disorders. However, certainly in the UK and Ireland over the last 10 years, services are often inadequate, inaccessible, inequitable, and not evidence-based. And this information is based on research, on governmental reports, and on media in both countries. I'll say at the early stages, Debbie and I also became aware that parents were continually reporting problems on difficulty accessing speech and language therapy locally. So we thought about some solutions. There was some evidence that parent training can help improve communication disorders in children with cleft palate. And there had been some very nice work by Nancy Shearer, Doublestein and Ha. There's also evidence of positive outcomes for parental involvement and home tasks for non-cleft speech disorders. And there's been some very thorough work done by Ellie Sugden in Australia, which supports parent involvement in speech and language therapy and non-cleft speech and language therapy. At that stage in 2012, 2014, connected health was being talked about, and not as much as it is now, but at that stage they were talking about it being effective in the management of a wide range of communication disorders, and there was some evidence for the management of speech disorders. And even in the last couple of months, I'm sure everyone has become aware of the impact of connected health and teletherapy in speech and language therapy, and it is really going to be the way forward from now on with COVID-19. In order to address the problems of difficulty accessing speech therapy, we ran a focus group initially in 2012. The focus group highlighted parental stress and anxiety. It informed ideas and potential formats for parental involvement in future management of speech disorders. In 2014, we ran a feasibility study, and this informed our recruitment, our intervention, and the pre and post outcome measures. So today we're going to talk mainly about the randomized controlled trial, the parental experiences of the approach, and implementation into clinical practice. So we ran a randomized controlled trial in 2016-2017. It was a 2-center comparative study looking at parent-led therapist-supervised articulation therapy, and became known as PLAT during that time. And we compared this to standard intervention for children with cleft palate speech disorders. The research was carried out in Trinity College Dublin, along with the Dublin Cleft Centre, and in Great Ormond Street Hospital, along with the North Thames Cleft Group. And it was carried out in 2 phases. The first phase was March to July in 2016, and the second phase in September to January 2017. The aim of the study was to test if PLAT intervention is comparable to speech outcomes from traditional typical weekly speech and language therapy or bi-weekly speech and language therapy. We also wanted to evaluate the impact of speech intervention on children's daily life in terms of activity and participation. And in fact, as far as we're aware, this is one of the few studies that has actually assessed activity and participation in children with cleft palate speech disorders following intervention. And finally, we wanted to evaluate the acceptability to parents of this approach, and Debbie's going to cover that part as we get to that stage. So in our inclusion criteria, we had children with cleft and non-cleft velopharyngeal dysfunction, aged between 2 years 9 months and 7 years 6 months. All children needed to have at least one cleft speech characteristic, but we also included children with and without velopharyngeal insufficiency, with and without syndromes, and with and without developmental speech disorders. The children needed to be stimulable on a minimum of 1 sound, preferably 2. They needed normal or near normal language development, so they would be able to manage the activities at home, and they needed to be fluent in English. We excluded children who had mild cleft speech characteristics, and by these I mean lateralization and palatalization, which are often difficult to treat even directly in speech and language therapy. And we also excluded children who were not stimulable on any intraoral air pressure. Children who had a bilateral hearing loss, over 30 dB, and any children who had learning, behavioural or neurological problems that might impact on their ability to cooperate during the intervention. Children with symptomatic fistula or who were due velopharyngeal insufficiency surgery were excluded, and if parents were unable to commit to the intervention, they weren't included in the study. Our outcome measures, for speech, we used adapted percent constant correct at word and sentence level. The percent constant correct has become a standard outcome measure for speech intervention studies in cleft and non-cleft speech disorders. And it is usually assessed by counting the number of sounds that the child produces and dividing it by the number of correct sounds and multiplying by 100. Activity and participation was assessed. Activity here was assessed using the Intelligibility in Context scale, which is a well-known scale. This is a questionnaire given to parents, and parents then are asked to rate their child's understandability in different contexts. The participation was assessed using focus on outcomes of communication of under 6s, and that's called focus for short. This is a longer parent questionnaire. There's about 50 questions in this. And this asks parents about how a child is interacting in their environment. And finally, qualitative analysis was carried out to assess parent experience. There were 5 data time point collections, and just to draw your attention to the speech was assessed at each of these 5 time points. So we had baseline assessment, before intervention, during intervention, midway during intervention, immediately post-intervention, and 2 months post-intervention. Other assessments were mainly just on initial and final stages. Speech assessments were analysed by an independent listener, and they had tested and had very good inter and intra-rate reliability, and this reliability study has been written up by Sell et al. 2019. So in the parent-led arm of the study, we had 23 children. Parents attended a 2-day training course where they learnt about how speech sounds were made, what happens when a child has a cleft palate, and general principles of speech and language therapy, how to manage the child at home during the therapy exercises. Parents were then given a 12-week therapy program with all the resources that they needed, and the program was given out in either 2 6-week blocks or maybe 4 3-week blocks, depending on the child and the time. Parents were then asked to carry out activities at home 5 days a week for 10 to 15 minutes per day. And they were supported by the cleft speech and language therapist using FaceTime. So FaceTime is the Apple version of Skype, or certainly some kind of the platform that we used for tele support. And we contacted the parents at week 3 and week 9 using FaceTime. And then at week 6, we saw them face to face. So in our control group, we had 21 dyads, parents and children. They received 6 one-hour speech and language therapy sessions with 2 non-cleft specialist speech and language therapists, with typical parental guidance. And they were seen on a fortnightly basis over the 12-week period. So results. The analysis indicated that for both words and sentences, both groups made statistically significant progress. You can see here on the red line is the parent group, and on the turquoise line is the green group, or the control group, and the same over here. We were happy that both groups made statistically significant progress, and in fact there was no difference between the 2 groups. And for activity and participation, Both groups made statistically significant progress. Here's our parent group here, and here's our control group here. And in participation, it was a similar pattern. So again, both groups made statistically significant progress, but there was no difference between the two groups. So now I'm going to hand over to Debbie, who's going to report on the parents and outcome and the implementation. Give me 1 sec now.
Okay.
Okay, Debbie, you should be ready. Yep.
Okay. Hello, everybody. I hope the screens are there properly for you. Yeah,
and
good.
So just for everyone else, we've bounced from Ireland now over to England for the next part of this presentation.
Yeah. Good, excellent. Well, very nice to have lots of you on the call. So this part is going to be discussing the parents, and we, as we know, we've called it Empowering Parents. We're going to focus on them now. So first of all, I'm going to just start with a little bit of quantitative data. The parents attended the 2-day training course, and at the beginning and end of each day, they had a quiz, and this was some data from 24 parents being tested after they'd done 5-hour day with us on day 1, and this was the quiz we had here on the right. And what we could see was that their mean scores changed significantly, as seen with our statistic here on the right hand corner. So they were they did well in terms of their learning. But the main bulk of what I want to talk about now is actually the parent experiences of the whole process. So there is a little bit of background to this. We know that parents are usually involved in speech sound disorder intervention, often in a supportive role. But there are very few studies looking across speech sound disorder literature, only 10% that actually report on parents' experiences and satisfaction. And often these are therapist-devised, non-validated, short, brief satisfaction questionnaires. There's just one qualitative study, which has been recently published, on the experiences of actually doing homework. And so the parent is the agent of change. So the aim of this part of our work was to report parents' experiences of being trained fully, we think, followed by doing homework in cleft speech disorders. Oops. Now what's happening here? Just a second. Okay, we'll go there to make the slides move on. So our methods were, we undertook some focus groups. There were 4 focus groups over the period. We had 16 participants, the majority were mothers. And we also undertook 3 semi-structured interviews in which there were 5 participants, and 2 of those interviews included both parents. So in total, we had 19 families, 83% of our families represented, and this is data based on 21 participants. The interviews and the focus groups were conducted by an independent speech and language therapist or psychologist, depending on the location. And we had an interview guide which focused on before the trial, their experiences of the training course, the intervention program, and the future. All of the recordings were transcribed, and we undertook a thematic analysis. And one of the investigators read and reread the transcripts, and the codes and themes and sub-themes have evolved, and they've been reviewed and refined by the 2 investigators. So this slide, I'm not going to go through all of this, but just to say we had 5 themes, and I'm going to focus on the ones that I've made in red, as this is really about the parents, to focus on these aspects in this part of the talk. So we're going to begin with the growth of parents. Then we're going to look at some of the challenges of undertaking therapy and some of their experiences of connected health, where you connect over the internet with your family, with lots of different platforms being available now, of course. So if we look at parents, what we saw was that there was a growth of parents, and this came out in different ways. So in terms of their knowledge and skills, what did they learn and say about speech and cleft speech problems? So one said, it gave me a better concept of what speech therapy is all about. It's easier to work with something you understand. So I knew why I was doing it. And for the first time ever, I knew why he was doing what he was doing and how you could work towards correcting it. And then they had this growth in their insights, so they could reflect on their previous therapy and say, the local speech therapist would say to you, you'll be doing 90% of the work, that's fine. But the difference in the guidance and the teaching, they just hand you sheets. But with this, you just got so much more, a different level altogether. And then in their feelings, and we can see how these evolve from feeling a bit daunted and worried at the beginning, right the way down here to the bottom. And this is an interesting one in the middle where they talked about their conflict about identity. So I didn't want her to feel all the time with me was doing work. So her parent sort of role versus doing these activities to satisfy. When he got it, it was really satisfying for me and for him. And this feeling of empowerment, this is in your own hands. How your child succeeds is down to you. And that's very empowering, really. That's the difference. In terms of challenges, they talked about too many resources. The resources were extensive, almost too much. I'm not sure everybody would have been able to have picked out the relevant things. And this led to some of the things we've subsequently done. They also talked about therapy, and just a couple of the comments they made. For example, the listening activities. She'd get upset with me saying the wrong sound. That was all part of the activity, of course. Or a loss of interest when I'd say to her, not quite right. And that's sort of managing the speech issue and the reinforcement. In terms of connected health and the support that we gave, what did they say? They were very positive about this. FaceTime was huge because they, the children, felt so important. I learned things that I wasn't doing quite 100% right. You absolutely needed this FaceTime or this connection over the internet, or you could have gone way off in the wrong direction. So this was a mixed methods study, and our conclusions are from the two parts that we presented today was that we have evidence of efficacy of both parent-led intervention when supervised by a cleft therapist and of standard therapy. And following this in-depth training, parent-led articulation therapy is acceptable to parents reporting an increased sense of empowerment and control. However, it's all very well to do the research, but actually as challenging, and possibly I would say even more challenging, is the challenge of getting changes into clinical practice. And there's a lot of science around this now, and we know it takes a long time. So we have some of the evidence base that we've shown you today, but we also got a lot of critical feedback during this process. And what that led us to understand we needed to do was to develop a cleft therapy and parent training online resource to get around some of these very clunky ways of communicating with the parent and sending resources, for example, and the training. And this is the website. We've recently launched it. You will see there's some provisions around it, and we'll talk about that in a moment related to COVID. So ultimately our aim was to empower trained parents to deliver therapy at home with the supervision of a therapist using connected health. I just want to show you what's in Speech at Home, and one of its unique aspects, there are four I'm going to just show you very, very briefly, is this one here is the Therapy Program Builder. So there is a way for the therapist to build programs that you can then send the link to the family with all of the resources. This is just to show you how this is a view that you as the therapist has, and obviously there's training associated with it. There are 180 activities built into the program, and you can build your own activities as well if you so wish. There's an availability to choose your sounds you wish to work on, and these activities are divided into groups. So there's a whole little section on listening activities, and then on eliciting sounds, and then working up through the speech hierarchy. This is what the parent gets here on the left, the parent program. So it's quite professionally produced. So here at the top are the aims that you've put into your program and you've gone through with the parents. This is actually on day one, their first activity. And you can see how it picks out the elements of sounds that you need, the right sounds that you need to be choosing because you've put them in. It brings up the resources you're going to need. And then you can do another activity, another activity. This is one of our videos that's in the database. It allows for you as allows the therapist to look in and see how they're getting on. So this parent did do this activity here and completed it, hasn't got to that one yet. And the parent can write a note here about how it's gone. So it allows you to get some information. So that is another element of the Speech at Home program. The third aspect, which we have some resources here, we've made some very familiar resources. They're low-tech, paper-based resources at the moment, and we have some specifically that we've designed with cleft speech in mind. So that's our third element. And the fourth element, which is not yet on the website, and we'll show you why in a moment, are the parent training courses and everything you need to run your courses. So what's happened is, of course, that we are in a new place and in a new world at the moment for all of us at different stages in this COVID experience. And so what have we've been doing more recently then around this? So we've had to pull back on training parents because the parents were changing groups, and clearly at the moment that cannot be put together in many places around the world. So we are piloting the therapist leading therapy in the usual way, using the program builder and connected health in 4 cleft centres in Ireland and the UK. And this originally was planned for the 30th of April as face-to-face training to get this off the ground. So again, this has all been held up, and we're needing to develop our webinars to go with this. And indeed, we've also now needing to do our training for all of the whole package, including all of the teaching of parents for the therapists, and we've got to make that now online. And ultimately, we've got to convert our fabulous parent training courses, which are sitting there waiting to be used, to an online medium, so that the whole thing becomes online. And so that's changed enormously in this COVID world. The advantage that we have had, however, is that telehealth and the use of connecting over the internet to families will be is the new way forward for health service delivery, probably in many places, even if we ever get to a place where we don't have a COVID type of climate around us. Of course, we want to make speech at home available internationally. We want to collaborate with our colleagues from all around the world, but particularly perhaps too in low middle income countries regarding the potential for implementation. And our longer term vision is to extend to some interactive resources, which actually, having sort of gone into this a little bit more recently, there is lovely potential to do that, but it takes a bit more funding, of course. So I'm now going to stop my sharing and I'm going to let Trina take over the screen. Trina?
Oh, there we go, Trina. You're all set.
Okay, can you see? You can see my screen, can you?
Not yet.
Not yet.
Oh, okay. Didn't work that time. Let's try it again.
Hooray! Yep.
Okay. Okay. So I'm unmuted, am I?
You are.
Yeah,
okay.
Perfect.
So Debbie's given you a good overview of the therapy program builder. I'm just going to show you, this is the kind of the background. So this is what you won't see if you go to look at the website at the moment. So you would need a username and password to get into this section. So here we're in the therapy program builder. And we have 2 little tutorials here showing you what resources are available and showing you how to use the therapy program builder. I'm just going to show you a program similar to the one that Debbie had. So we look at little JJ is our child here, and we have various options. We can edit this program, we can view it, we can copy it. So I'm going to just go into edit to show you what a speech therapist might do. So we already have the child's name and the overall aims of the program, and here you can see the activities. These activities can be changed by just clicking on the minus button here and adding a new one. We can remove the activity altogether. We can remove the days. So we've got lots of options here. You can see here, for example, we have this activity is the target sound is S, and we want the child to learn to associate the target sound with the S sound. And that's very straightforward. And that's automatically linked now to the S card, which you'll see in a minute. We go down here, we have day 2. Here's activity 1. And this is a simple one, getting the child to look at a video on how S is made. So if I wanted to add another activity, I would just click down here, add activity. I would select one of the existing activities or my own. So I want to do an existing activity. Here we have our different sounds. Let's say I was working on the k sound as well. And here we have the filter that Debbie was talking about that shows you all the activities filtered down into what the aims are. So these are learning sounds in isolation, in syllables, words, phrases, up to connected speech. Learning sounds through concept, elicitation, sound card association, etc. And learning to establish the sound at syllable level in all word positions, word level, and so on. So we might just take word, the beginning of words, and we can say maybe play a pairs game using these the pictures with K at the beginning of words and so on. So you can keep adding days, you can add weeks, and you can add activities. And once you've done that, then you can up here and update or publish depending on what stage you're at. Here you'll see that you have a link here, and you copy this link to send to the parents. You email that to the parents, and then the parents can come in and see their version of the program. So if I click on here, you'll see the parents program. So you can see that's nice program here with our activities, and as Debbie says, with some of the resources, with all the resources linked. Here's our video one. We can just show you we have videos on how all the sounds are made. So that's directly links, and then this is what the parents will see then.
There's no sound.
It's okay.
Okay, we get the...
Okay, no sound. So you get the idea.
We get the idea though, yeah, that's
right.
Great.
So that's giving you an overview. We haven't got the teaching videos up yet, as Debbie says, but that's to go up in the next short while.
Thank you.
So I think that gives you a good overview of the speech at home.
Thank you, Dr. Debbie, Dr. Trina. Wow, so much to discuss in this. As always, if this is your first time in the Circle of Cleft Professionals, you know, we always leave a good amount of time for people to think through what are your questions about how you'd apply this research or this tool into your own context. And as we've mentioned several times today, it seems to be especially timely as we're all wrestling with constraints of COVID-19 and the current era. So as a reminder, feel free, you can type your questions, either send them directly to me privately or to post them publicly, and we'll spend some time discussing all the way through. Dr. Trina and Dr. Debbie are willing to address some of their questions, and also we'd love to hear some of the things that you're wrestling with in your own context as you look to deliver speech therapy in the current era. So I think we had Karen from Santiago de Chile kick us off here and wanted to know a little bit more about this response you saw of generalization of speech, and was that better in those children with trained parents? Can you just review your research a little bit? How did the generalization of speech work from the trained parents versus the other ways that you've tested?
Trina, that's hilarious because you can't look at each other. Well, I think in theory, we'd like to think that the parents who are trained actually take forward that training even when you have stopped your intervention. So they have this better insight. In truth, we had a 2-month follow-up, which we've reported in our research. We didn't have funding, and in a randomized controlled trial, this is often a constraint to do any further follow-up after that. So we wouldn't really truthfully be able to say on the basis of the research, we know that, I say at 6 months post-operatively, post-therapy, which group was doing better. But that training, you don't take away your training when you stop therapy, of course.
Thank you. Professor Rupa has a question. How are we able to vary the activities based on the age of the child? So a specific question about your research.
Well, during the research, we actually wrote the programs for that child. So the program would have focused on the age of the child. One of the problems at the time for us to write the programs was it was taking us 6 hours to write each program. And as a result, that was one of the reasons why we went back to to thinking about doing this online and using the kind of a knowledge-based system. So there are enough activities there that for children, certainly just over 2 years, 9 months, or 3 years, the activities can vary up to the 6, 7, 8-year-olds. And there's quite a variety there. Right.
So shall I just add, I don't know if you've unmuted me.
Yes, no, you'll stay unmuted.
Okay. I think it's also appropriate to add that part of the great thing about having the parents together in training is that there was a lot of creative talking around because it was spread over 2 days with a little bit of space between those 2 days. So they went away and they thought about some of those things. And actually what they were doing was often bringing their ideas for how they adjusted or adapted an activity which suited their family. So I know Trina had a great example of a boy that loved jumping on the bed, and whenever he did this, he managed to say his sounds, etc., etc. So, of course, the pictures are the pictures, and we know that there are many systems out there that one could also not necessarily build into the program, but when you've got your trained parent who understands it, they could go and access something that maybe is more appropriate for the older child. But actually, just getting this resource together is certainly challenging enough.
Thank you.
And the other point is that there is an option to write your own activities, so that if you felt that you needed something a little bit more for an older child or a younger child, then you have that option as well.
Thank you. So there's a lot of questions pouring in. One theme that I heard that we've seen in many of the Circle of Cleft Professionals webinars has been that idea of empowering parents, whether it's in pre-surgical NAM, whether it's in psychosocial support. There's been quite a few questions about the parent group. First of all, I guess, what was your hypothesis originally about parents' capacity to get these better speech outcomes on their own? And then we've had a few discussions or questions about the parents' ages, the parents' education levels. What are some of your insights into how successful they were based on the descriptions or the socioeconomic status of the parents?
Oh, that's a good question. Certainly it didn't necessarily go with the sort of most educated were the best. One family were 2 teachers, and it was very hard for it to become a very teacherish way of delivery. And they had very high expectations. And so actually, I don't think it was necessarily that as much as parents' motivation. And some of that was actually, they'd been into therapy. They had seen a speech therapist. They'd done assessments and they'd been put on review, but they'd never actually had any regular treatment. And so by the time they came and were there, they were so motivated to do something. And I think that really played into it as well. I don't know, Trina, if you want to add.
Yeah, no, I would agree. We just looked briefly at the educational level and socioeconomic status. It didn't seem to make any difference. And it really, I think for us, the big factor was the parent motivation.
I see Kate Crawley has a question. Do you want to read it, Kate, or do you like me to read it for you? We'll just unmute you here. Go. There you go. Yeah, go ahead.
Hi, Kate.
Hi, everybody.
Hi.
Now, where did I write it?
Yeah, I've got it.
Is the only good goal a place of articulation for consonant correct? And how do you deal in your research with children who have had an initial palate repair but may need speech surgery or VPD? How does this reflected in your training? Sorry, Kate. I got you on and then read it for you.
Okay.
Sorry. So can we just go back? The first question was?
Yes. Basically,
it's on the.
We sometimes need speech therapy to figure out whether they need speech surgery.
Yes.
And so how do you deal with your percent of consonants correct, or are you working towards a good place of articulation as opposed to producing the oral sounds through?
Yeah. So we used place and manner of articulation. We accepted as correct sounds that were were nasalized or weak pressure or with nasal emission, nasal turbulence with symptoms of VPI. And so we actually just what I meant by an adapted PCC.
Perfect.
And I just adding to that, Kate, they needed to be stimulable. So it didn't matter if they were needing, so if they were hypernasal, but if they had stimulability with those characteristics that Trina's just described, they could be in the program. And the program, the training, really described this to the family, so they understood about the PI at the end of their 2-day training. So yeah, I think that's the answer.
Perfect. Thank you.
Thank you. Well, there's a couple more technical questions, and then I think we need, there's quite a few questions just about applying it in areas, you know, low and middle income countries. So we'll do a couple more technical questions if that's all right, and then we'll move more into some of the context people are facing and what advice you might have. So can you explain a little bit more about what your thoughts are around this group parent training if you have to do it in telehealth? You know, how might that impact your way forward, or what you would have? What's your expectation?
Yeah, that's a really interesting question again, because actually we have evidence, don't we, for group training. We don't actually have evidence for it going into an online, you know, parents accessing the modules. So I'm sorry, I'm getting some feedback. So we would have to. You'd really need to evaluate that as well, but because of where we are and how COVID is probably going to pan out, it won't be that the other important thing to say here, that this isn't appropriate for every family. It's something you can offer to some families, or some families buy into it. So it's not a panacea for every single person with a speech disorder. So again, doing the online access, well, to be honest, Karen, Trina and I are learning a lot about doing webinars at the moment and thinking about how that's going to look. And we really need funding for that, because we have a company that obviously we have partnership with our people that have done our website and built the builder, and they're very, just surprisingly, they're very keen to continue to work with us. But that we will obviously need a lot of education from other people around how that's going to look, and so we'll be looking to really evaluate that as we do it.
One of the aspects we feel very strongly about is making sure that any online training is interactive. So it won't be just a webinar where you give information, but I think it'll be information where we can stop and start and ask questions. So we've been exploring over the last 2 weeks actually, well, how would we adapt what we've already got to make that more applicable to an online resource? But I do think it has to be interactive, so the parents are interacting with each other as well as interacting with us, because that was one of the really positive things about the parent training.
Yeah,
thank you.
And actually one of the features that we'd probably try and build in is things like polls and quizzes as you go along. So there's expertise out there to really help you do this, but it's a big job.
So before we switch into some of these challenges, especially that a lot of the partners on the call are facing, one more specific question about the research itself. What types of activities did you find the parents were most engaged with? What types of speech training did they find most engaging?
I think it varied hugely from across, and I think that's classic speech therapy. Yeah, and one of the things we were very conscious of after the parent training was we gave the parents some flexibility. So when we gave them activity, we gave them the flexibility to adapt that activity to suit their child. So they mightn't have done exactly what we'd said they were to do, but they would make sure that they were doing the aim and doing it at the right level with the right sounds, etc. So maybe instead of playing a card game, they were taking the cards and taking them outside and playing hide and seek around the garden or something like that. So they had that adaptability. And in fact, that surprised us. It certainly surprised me that how adaptable the parents were and how tuned in they were to what their kids liked and the activities that they did with them. We had one child in the training session, after the training session, where we had told the parents not to do any therapy, but this mother was really enthusiastic. And this child had an active nasal fricative, like a sound for 7 consonants. And the mum took all the sounds, stuck them onto footballs and put them out in the garden, and he spent 2 weeks in the garden. Every time he said the sound correctly, he kicked the ball into goal. When he came back for his pre-intervention assessment, which is time 2, he wasn't using any active nasal fricative. So that shows you how innovative parents are.
Wow. And obviously parents are the most invested, if not the patient, but the parents are the most invested in seeing this progress as well. It's amazing to be able to encourage that kind of creativity and leadership really from parents. So I did promise, and we have a lot of questions about, you know, how this research can work. So I think the first stage is to establish, what do you think your research means for parents in low and middle income countries, first of all, and then we can switch a little bit to the tools that you're proposing and some of the challenges that were there. But you know, both of you have experience in supporting colleagues around the world. How do you feel like this research is applicable in different places, and what does it lead you to think?
That's a big question. Well, we have to be very aware that this is something that we've developed, and you know, culturally, you always need to adjust things. And of course, all the materials are in English at the moment. I think, as it stands, the training is. We did it 8 times in the end, and we really refined it. And it was really translated to be available for a parent to access. So I think there would be bits of the training that could be very helpful, perhaps for people that haven't, you know, would like to see how that looks, and some of the elicitation and some of the stuff that we do in listening, which actually sometimes can be overlooked, and some of the materials to do with non-words, all of that is applicable, because actually across languages, well, there will be some sounds, clearly we've used the English language sounds, but there is a common set of sounds quite often used, particularly the plosives, and 1 or 2 fricatives maybe. So I don't know, I think that's such a big question, and it's about actually taking it somewhere and you know, looking at it with colleagues who are keen to look at it, I think. Trina, do you have any questions?
Just, I know I've discussed this with Brahani, who's delighted to see here, and lovely to see with DC from McCunnan from Ethiopia here as well. And one of the things that we found a discussion was, I think we're going to have to look at how to adapt it in terms of literacy skills as well. So I think there's a huge body of work to adapt this for lower middle income, but I think it's a challenge that that's certainly doable. But as Debbie says, we need to be working closely with our colleagues in these countries.
Yeah, and actually there's a very important question, which I'm just going to reply to, that Karen has put up, about the importance of the initial face-to-face assessment. And indeed, this is, it makes it very much easier if you have seen the child and you've done the assessment face-to-face. And within the research study, as you heard, we had telehealth, we connected on week 9 and week 3 and week 9, but we saw that patient in the middle of that period at week 6, which again felt very sort of reassuring. So this isn't, you know, this isn't in its whole thing that it all goes to telehealth necessarily, but those initial face-to-face assessments. But having said that, at the moment we can't see any patients in clinics, so you have to do what you can using telehealth. And actually the audio is pretty good for that. You might miss some subtle issues like accompanying nasal turbulence and emission, but we are in the business there of really trying to change that anyway. So you are looking at sounds that they can't do, that the parent can easily hear. And part of that training is about them learning to listen and to identify the sounds of the error sounds in their own children, and to really pull that apart. And that is another group sort of activity. So yes, the face-to-face is really very important.
Good, thank you. That's super helpful.
Can I add something?
Please, Karen, and then we'll go to Suraj in Chennai.
It's because it's helpful, but thinking that sometime COVID will stop, hopefully.
Yes.
And that will keep with this telemedicine. Many countries and many speech and language therapists will keep doing this, even we don't are anymore in this COVID surrounding. And I feel that it's very important to dress out that even we have this great tool, and it's a huge work what you have done. The face-to-face assessment, it's very important not to lose, because you have to have that information, the oral cavity information, how is the dentition, has the tight
Yes.
fistula and blah, blah, blah. So it's important for future, maybe not now, but
Yes.
for future, that we don't lose that important part of our practice.
Yeah.
Thank you, Karen.
I think this response, I think it's going to be a combination going forward, a combination of face-to-face where you can, and then teletherapy. And as Debbie says, this won't suit all children. There will be children where you'll need to be working face-to-face continually, I think.
Sure, and as you've mentioned, also there are parents, even in the UK, Ireland, you know, for whom this is not a good fit. So I think it's just important to recognize, we invited Dr. Trina and Dr. Debbie, it was a year ago we first started talking about a webinar here. This is not coming forward to say, hey, here is the solution to COVID-19, or even here is the solution for parents who don't have access to the internet. I think, you know, as you suggested, there is research here that's very encouraging for those of us who are focused on equipping parents to show that it can be very effective. And I think this is the beginning of discussions of things like translation, of how to reach those parents who don't have access to the internet, of integration of face-to-face as well as telehealth, as you're saying, as COVID restrictions allow. So just to be clear with everyone, we didn't invite the two of you to provide the solution to everyone's context right now, but obviously, you know, it did anticipate some of these changes in a really interesting way, as now we're all forced to really think about different modalities of speech therapy. I'll move to Suraj quickly, who had his hand up, please, and Chennai.
Yeah, thank you so much. Wonderful listening to you. The platform which you have set up is terrific, and I think you follow the store and forward method, because all the programs are uploaded, so parent at the other end can see. So does the program also have an option of parent recording their entire therapy session and loading onto the website, and you get to review it? Do you have that option?
Not yet, no. What a good idea.
That would be, when we get the funding, that could be for our next phase.
Great. No, this is great. Great ideas. Thank you,
idea.
Suraj.
Very good.
Okay.
Good. I'm going to keep working through. So Julio in Argentina was interested just in how therapists are remunerated for things like telehealth, and I think this is probably a bigger conversation as things shifted. But just for your purposes, how did payment go for Cleft SLPs in this process?
So this was a research project, and it was conducted in Ireland and the UK, where you have your health service, you have your health services as part of, you pay for it through your taxes, but because it was a research project, the parents came and we were able to see them under that umbrella. So it didn't really involve payment as such.
Thank you. Yep. I think it's something everyone's wrestling with here in Canada as well. I mean, new options for telehealth and remuneration within the public scheme is top of mind for everyone. So very helpful. We just have a couple, 1 or 2 minutes left. If you put your hand up, or if there's anyone who else, I mean, there's lots we haven't covered here, but I think this idea of another suggestion from Karen was around group training via live video chat. I mean, I think you've established there's lots of different options you'll need to pursue now without the ability of doing face-to-face, I think.
Yeah, thank you. Yeah, no, that's very good.
Very good. Well, Niti, I'll ask you to invite us to put the slides back up. Obviously, there is so much more to discuss as telehealth, training parents, as moving forward in new ways of doing speech therapy is so important to figure out right now. And so I'm really delighted for this interaction. We could obviously go on for another hour easily. If you have a colleague you think, oh, this is amazing, they need to see it, or if some of the research parts of it you'd like to review again, we will be posting on YouTube the video of today's call, and you'll be able to review that at your leisure. It's also available on the Slack channel, and obviously there are so many questions and so much nuance that we need to get through as we work through how to do comprehensive cleft care and speech therapy in particular in the COVID era. So we'll invite you online. We're available, Niti and I, to help you get onto Slack if you'd like to. I know many of you have posted before, but as you'll see, there's more and more things happening there, and I think that together we can start to figure out what can be applied from these kinds of resources into our own context, as we're also desperate to move forward with families who are just waiting for support and can't access it the way they'd want, or they can't access it the way we would love to provide it. You can also follow Circle Cleft Professional on Twitter at Cleft Circle. If we can go to the next slide, Niti. And we're going to keep talking about, what partnerships look like. So Dr. Debbie and Dr. Trina talked a lot about funding, how it all works together. This idea of partnerships between cleft professionals and NGOs is critical, and how we work out some of these partnerships between experts or organizations based in the UK, Canada, US, whatever, and in our local environments. So there is another UK-based organization called PHET in London, and they've been really pushing forward on this idea of how we have this dialogue of working well together. And so they'll present this idea of these health partnerships, how we might be able to move forward, especially with all these new needs around interactivity through the internet, around paying of SLPs, as was brought up. There's lots to work out there. So we hope you'll join us in just a few weeks' time, Tuesday, June 9th, to talk with these experts from PHET London around international development partnerships. And we'll be delighted to see you there. So again, thank you to everybody. Thank you to Dr. Debbie Sell, Dr. Trina Sweeney, all the experts who joined and contributed. We'll be delighted to continue the conversation. Feel free to send us an email at info@cleftcircle.org. And again, a real thank you to all the cleft organizations who have been sponsoring these webinars. And this, again, thank you to everyone. This has been our biggest turnout. So obviously in the COVID-19 era, there's lots of desire to learn and figure out how we move forward in this era. And again, just to say, all of you who are facing really difficult moments now, we're thinking of you. You're not alone, and we're really hoping for the best. So thank you for joining us even amidst it all.